morning, good afternoon. Hello, everyone. Today, we're here to talk about the Epilepsy Assessment Management National Epilepsy Course that we're on across low and middle income countries. I'll just introduce myself to you. My name is Olaniyan, and I am the CEO of Pretola Global Health and Consulting Limited. I am also a registered learning disability nurse specializing in epilepsy. So today up here, we've got Torie Robinson, we've got Samuel Chigamba, and we've also got Millie Kumwanda here today too for us to have a chat about this interesting topic. Millie is actually one of our participants on the EAMC course. So today she'll be sharing with us our experience on the course and why she registered for the course. So hopefully you will find today's chat interesting. Torie, do you want to introduce yourself to us?
Yes, hi everybody. So as Tolu's kindly said, my name is Torie Robinson, and I am a keynote public speaker regarding epilepsy and mental health. And I'm also a patient, so I have epilepsy myself. I have had a temporal lobe resection. I've also personal great experience in the whole mental health sphere, former inpatient. And I'm here taking part on this course to give our students insight into things from the patient perspective and actually also the carer perspective, and how they are able to relate to us more closely as well, because it's such a key thing, not just to provide treatment for people affected by epilepsy, but also care and to have insight into things from their perspective.
Thank you, Torie. Thank you. Samuel, do you want to introduce yourself?
Thank you very much. Hi, everybody. My name is Samuel Chigamba. I'm a disability advocate. I'm also a executive director at Epilepsy Warriors Foundation Malawi. Also vice president for Southern Africa under Epilepsy Alliance Africa. And I also chair Chor District Disability Forum. Thank you.
Oh, thank you. It's lovely to hear that about all you, Samuel. Thank you. Millie, kindly introduce yourself to us.
My name is Millie Kumwanda. I'm working at Queen Elizabeth Central Hospital, the referral hospital. I was trained to be a mental health nurse and epilepsy nurse. Thank you.
Thank you. Samuel, can you kindly tell us a little bit more about Epilepsy Warriors Foundation? What do you do?
Yeah, the thing is, on my introduction, I didn't mention one thing. I am also a patient. I have epilepsy, so I'm the founder. Growing up with epilepsy and having to face most of the challenges that as persons with epilepsy go through motivated me to, founding the foundation. So basically, our mission is to promote human rights, epilepsy awareness, and inclusive societies. Yes, so we have education programs, awareness. We do advocacy. We also do youth and women empowerment activities. Yes, so mainly is we just want to address the most urgent and pressing needs of persons with epilepsy. Yeah,
it's so important, isn't it? Making sure that people with epilepsy are treated as human, just like everyone else. Their human rights upheld, and you're doing a great job. Doing that in itself is huge and important. So well done for all you do in Malawi. Well done. Millie, as well, you are a nurse, you specialize in epilepsy, so we'll call you an epilepsy specialist nurse in your own right. Can you tell us about your work, what you do with people with epilepsy in
Okay, thank you. When the patient comes to the clinic, we welcome them. What is important is we have to take a thorough history, that is from the guardians. We give them health talk, health education about what happens when somebody is having seizures. We tell them what to do and where to go when they see such kind of symptoms happening to them. We give the awareness campaigns. That is when we have money, we go out to preach the word about epilepsy. We give drugs to our patients. They don't go to the pharmacy. We help each other with the foundation. There are some patients, so they help us, like they somewhere in the group anyway. They come and they help us to give the treatment. Thank you.
Thank you. Thank you for that. Torie?
Yeah, so I wanted to ask you also, Millie, what made you want to actually register for the course in the first place? Obviously, you have a professional background in epilepsy, but what got your attention about this course?
The course has really helped us, though we don't have like the EEG machine, but we are able to make the right diagnosis. We have also learned that when we have to make a diagnosis, we have to take like thorough history and do some other tests, of which we are not doing that. So through the course, we've learned a lot about to do the EEG, to do some other tests which can allow us to come up with the right diagnosis to the patients, and also the drugs, which we might say some of the drugs we don't have them, but we have learned that there are some drugs which can treat epilepsy. Yeah, thank you.
Right.
Thank you. Samuel, why did you decide to sponsor come on the course?
I think, first of all, I'd like to thank our supporters. Without them, it would have been possible for us to sponsor Mary on this course. Yeah, so what happened was that last year, Millie and I got into a conversation. The thing is that most health facilities lack the technical skills on how to assist persons with epilepsy, and most of them lack the capacity. So we started discussing, and we came up with an idea of training staff or nurses at health facilities, and also health surveillance assistants. So it just took a few months after that. It was when I met you, Tolu. It was during a webinar organized by Epilepsy Alliance Africa. That's when you introduced the course. So immediately I remembered Mary, and I got interested that she would be the right person to attend the course. So that's what motivated me to sponsoring Mary.
And I can actually say that you were quite passionate about sponsoring Millie, because I remember I'd only spoken on the Epilepsy Alliance webinar. And I think within an hour or something, you sent me a message as to, we're registering someone on it. Please keep a slot for us. And I said, yeah, we'll do it. So the passion came across to me from the message you sent to me, and really within days you were able to get that sorted. And that in itself speaks a lot. That in itself reflects the fact that you want to build capacity, which is what the course is about. building epilepsy capacity in our countries, Millie can take back some of what she's learned to, support our colleagues back in Malawi. And before we know it, it's like wildfire. We're spreading it, we set a fire somewhere and then it spread and spread, and we're supporting others. And before we know it, we're giving better quality, better care to people with epilepsy. Tori, did you want to say something? Yeah.
I just wanted to comment on that too. I know I'm not supposed to, but I think half the battle actually is having people like both of you, Samuel and Millie, who have that passion for helping patients and carers, and also being open to whether it be contradiction or just new information that is up to date. So I think it really, really is half the battle. Would you not agree, Tolu?
Oh yeah, definitely. Both organizations, well, both Millie is a clinician, Samuel is an advocate, both working together collaboratively. Yes. That is what we need, really. That's the way forward.
Isn't it, really?
Yeah. That's the way forward. That's the way forward. So, sorry.
Yeah, so I wanted to ask again, both of you. So this is probably quite a deep question and we can only touch the surface, but what are the issues with epilepsy care in Malawi? I guess, so for patients, for you two, for carers, and the overall thing really, what are the main issues right now?
The issues are many, but we'll just mention a few. The beliefs and the rumors and the like. So people believe that when one has epilepsy, it means they have been bewitched, and the one having epilepsy should not eat eggs. They shouldn't go to the public, even to the church. They shouldn't attend the meeting and the like. They don't go to school. They should not eat pigs. They should not go to work. They should not get married. Yeah, so there are so many things. Yeah, issues, yes.
Can I ask, before you move on that one, two things you've said there I've never heard before. Don't eat eggs and don't eat pigs. What does eggs and pigs got to do with epilepsy?
Yeah, what?
Yeah. I think it's just, some people believe that a person with epilepsy should not eat pork. So
but why?
Actually, I just remember somebody did a study. There was an organization that did a study on it, that when pork is not well cooked, one might develop some worms in the brain. So I don't know if it's connected to that, or it's something that I have to do some research on. Yeah.
Well, I would say you don't have to do research on it, because we both know that there's like ridiculous. But wow, it's just so interesting to learn where these things come from, these thoughts, because I think then we can like really challenge people. It's just like, really?
You can see the stigma. You can see where it's been, Yeah.
To answer Tolu's question, I think firstly I would like to thank the Malawian government for its support. Because a person with epilepsy in Malawi receive anti-epileptic medication for free.
Wow.
That doesn't happen in everywhere in the world. It's only a few countries. Yeah. So I think on the challenges, I would say that like I mentioned earlier, that there's a knowledge gap in most health facilities. I think on epilepsy care, I think that's an issue. Yeah. So we have lots of challenges, but our government are working on it. We've been engaging the government, and the changes are being happening. We used to have a shortage of medication in the past, but now medicines are available. Yeah, so besides having the myths and stigma, discrimination, persons with epilepsy, failing to, enjoy their right to employment, the right to, education, even some even have challenges, marrying, so, little by little, I think things will change. Yeah, I've forgotten.
So common in
Tolu.
those with epilepsy, forgetting the word.
I forgot your name actually. Sorry.
Oh, outrageous, Torie.
Yeah,
don't worry.
Torie, yeah. Like you were mentioning that, some of the things, we can start to challenge people. Yeah, so, it's good that we have the facts. So with the myths that, we have, always needed is for us to do the awareness, sensitize people on the real facts surrounding epilepsy. Yeah.
Thank you for that. And I would also want to echo that thanks as well to the Malawian government.
Same here. I was like, wow,
Yeah.
I'm so thankful.
Thank you for that. And actually, I think that's the first African government that I know. There might be more doing it, but that I know of, providing anti-epileptic medication for free countries. In the UK, we get it free as well. Well, isn't it, Torie?
Well, we pay for it indirectly through taxes and NI, but yes, we don't have to pay upon when we go to the pharmacy, and rightly so. Nobody should have to.
Yeah. So thank you to the government for that.
Mm.
Now, so the next question I would want to ask Millie is on the course. What have you gained? What would you say so far? Because we're going to week 4 tomorrow. Yeah. So we're on week 4 tomorrow. We've had 4 weeks. We've had 3 weeks teaching, and we've had 6 topics so far on weeks teaching from the teaching. And what would you say would be your highlights or your most memorable experience on the course in itself?
My memorable experience was on how to make a diagnosis. It was quite exciting that through proper history, you can make the diagnosis because, Malawi is a poor country, but we're still applying the resources which we have and make that right diagnosis. By and by, we just received one of the doctors who is the neuro, who has come to visit us, of which I thought we were not wrong making our diagnoses. But I've also learned that through the EEG and sometimes CT scan, you can also make the diagnosis. Yeah, thank you.
Thank you. That was very powerful. The session by Dr. Mike Kinney about history taking. I think that was a light bulb moment for a lot of people. The fact that if we can get the history taken right from the beginning, we can do a whole lot. But once we get the history taken wrong, if we make mistakes, we we don't get the right information, then it would cause chaos. We would not be able to get the right diagnosis. We won't have the right diagnosis, and of course it would have to affect the treatment plan as well. So that it's so important to get it right from the beginning. I've learned a lot as well on the course, just being a part of it, even though I have facilitated it, put it together, but actually I've also had my pen and paper on the side, scribbling and learning a lot, because you can't know everything. There's no way you
Right.
can know everything. And learning from this experts from different parts of the of different parts of the UK and outside of the UK, in Belgium and others, has been quite great, really, really. Torie?
Yeah. Oh, I've forgotten what I was going to say now. um, so I've written it down. But I wanted to ask next. Oh yeah. So everything that you have learned so far, as Tolu was saying on the course, only so far, because you're yet to hear things from the patient perspective. How is that information going to help you provide better care for your patients, which will impact the lives also of the carers and society as a whole? And also, actually, this isn't in the official question, but how do you think that's also going to impact their mental health? Because of course, there's such a tight link between both epilepsy and mental health.
Yeah, it has helped me, like doing some other tests of which we're not doing, like the blood tests, giving the awareness, like health education. We could do it, but blah, 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 yeah. But we need to take time, not just rush. We need to listen carefully from the guardians and the patient, what they are explaining. And also the videos which they were being shown. This is one of the things that we always miss. We can tell the guardians just to capture the video when they are coming back to the clinic so that they should show us. Most of the times when we were learning the clinic, we missed that. So I've learned that we can tell the guardians to just to take a picture of the seizure, the way how they are behaving when they're having the seizure, so that will help us to make the right diagnosis or to help the patient the right treatment to our patients. Thank you.
Yeah, you're so right, Millie. Having a video to as evidence to collaborate what is being said really helps to reinforce a thing. It's a visual prompt of what's going on as
Because
well.
sometimes it can be hard to actually describe what you've experienced. And also it can be hard, I think, for people who've witnessed it, because they can be a bit scared sometimes.
Definitely.
And also, if you are not having a tonic-clonic seizure, if somebody is having, say, an absent seizure and they're staring into space, people are like, well, you're just not paying attention, or, you know, but if you can have a video of that as well, I think that's really, really powerful.
Yeah, it is. And it's more of an objective. It's an
Exactly.
objective evidence. It's not, oh, I think it was the right arm that was moving. I think it was the head that was moving. I think is not objective, but that in itself, the video is the only bit that we say, and which is what we advise clinically here, is you have to make sure you ask for the consent of the person. So, for example, the mom, the dad will tell the child, the youngster, saying, look, is it okay for us to, whenever you're having the seizures, we take a few minutes recording of it. It's not to be shared. It's not what should be on social media because it's private. So those are the bits where when we're counseling people about it, as you know, discussing their guardians and patients, there's some ethical issues around it. So here in the UK, you cannot just go and record someone. You have to, there are rules about it. The individual can say, mom, do it for me, fine, but mom or dad is not allowed to go and post it on social media, because these days people are not even thinking, a lot of people are not even thinking of what should be on social media and what should not, but there are ethical issues around it. So, and that actually, you know, we don't want to continue, we're trying to reduce the stigma Okay,
Yeah.
just putting a video out of context out there actually does not protect the privacy of the patient and actually reinforces stigma as well. And it's just wrong.
And do you know what? I see this all the time from various different countries, not just say, for instance, from Malawi, or it's people, parents do it a lot. And I think, oh my goodness, if my parents had done that, I would be outraged. Like, that is totally my privacy. And like, whether it be a tonic, clonic, myoclonic, or whatever type of seizure, it doesn't matter. Like, that is my experience, my body, my face. And the trouble is also, if you put these videos or photos, whatever, on social media, they are there forever. And it's just so totally unethical. I understand why people do it, especially when there isn't the support that they need and they want to get opinions of other people, but we need to remember to keep that information between patient, carer, and clinician, and only share it, as Tolu was saying, if and assuming the patient has the ability to give permission, of course.
Give permission, yeah. And even when they don't have the ability to give permission, they've what do you need? What's the purpose of taking the video? Which is for clinical, diagnosis. So you take the video as a parent, and then you take it to the clinic, and the doctor and the nurse can see it, and that ends it, and you can delete it, going forward. So it's just been that's part of the advice we would give on that as well. But yes, that is it's understanding that with epilepsy, it's not just having seizures. It's not just the physical seizures. We have people that they've been seizure free, but then they're still having the mental health side effects of the medication, and also the associated with having the condition in itself. So it's the management of both the epilepsy and the mental. Actually, we'll be coming up to the topic of the mental health in a couple of weeks, when we'll be taking mental health and epilepsy, and that will create more awareness and also educate our participants more about that. So I'm looking forward to actually learning from Dr. Sarah from Melbourne on that, and also from Torie herself. Yeah. Well, thank you all for joining in today, and it's more of a reflective session for us, because we're thinking about the course, we're thinking about the impact and the need for it in low and middle income countries, and the topics, the teaching, provide where we are. The aim of it, like we said, is to build epilepsy capacity in our countries. And thank you, Millie, for joining in.
Yeah,
we've done some projects on the course, and we will be publishing some papers from the project as well. And really, it's been fantastic learning alongside you all as well. We've had great feedback as well from other participants from the course, and we're still looking forward to the remaining weeks that we've got left on the course. Torie, do you want to say anything to round up?
Oh my goodness. Well, to be honest, I would repeat everything of what you've just said, Tolu. And it's just, I want to say that both you, Samuel and Millie, you just really inspired me for today. It's so wonderful to have people such as you, despite the struggles, like it being productive, reaching out, wanting to learn more, and and also again, backing up what Tolu has said, it's wonderful for us to learn from you as well and see things from a different angle. And it's really, really valuable. And I guess one of the great things about online content and communication today is that we can all learn from each other. And there are no doubt going to be several tips that us in the UK and other parts of the world can get from you in Malawi. So thank you very much.
Thank you.
You're welcome.
Thank you.
You're welcome. Torie, there was a question about social media.
Oh, yes, that's right. So I wanted to ask both of you about your presence online on social media, if you have a website, and how do people contact you through that if you do have a presence? Could you provide us with the URLs or the name of your organizations again so that people can find you, please?
Yeah. Our website is currently being designed. So we are on Instagram and Facebook. So on Facebook, we are Epilepsy Warriors Foundation. And it's the same with Instagram also.
Okay,
Epilepsy Warriors
great.
Foundation. Yeah.
And I'm also going to put you, as I mentioned to you earlier, onto the Epilepsy Sparks website, actually, because on there we've got incredible organizations. So that's going to be fabulous. So everybody make sure that you follow these guys, and we can all provide emotional encouragement, I think, and professional encouragement to each other.
Yeah.
Thank you. Thank you for today's chat. Thank you for coming on board. Thank you, Millie, for the time, and thank you, Samuel, as well. I would also like to say a big thank you to the government of Malawi for the work you're doing for people with epilepsy in your country, and we really, really want to say thank you and also encourage you to, we need more of it. We need more advocacy for people with epilepsy. We want to be able to we want to be able to support them as much as possible to ease the stigma, remove the stigma that they're facing. People with epilepsy are facing so much stigma that it's just, immense. We want to be able to, we're hoping as a government, you'll be able to prioritize that, take it as a important initiative for your government. People with epilepsy, both children, adults, as well.
And carers, families,
and carers, families as well. And we'd also like to say thank you to the organization that supported Millie with the Wi-Fi capacity for her to be able to join on the course, because that is so important. Really, a lot of people are pulled in together to be able to support Millie to join on this course. Thank you for that. And I also like to say thank you, Samuel, as the lead, the head of Epilepsy Warriors Foundation. We see what you do. You are in Malawi, we're here in the UK. We see what you do. Great job. Keep it up. And thank you for supporting Millie. And I also like to say thank you, Millie. As a nurse, I know, I understand what you're going through. Nurse to nurse, clinician to clinician. Great job. Well done. Keep up the good work. And thank you for joining in on the course as well. Hopefully, we believe you've learned a lot. You will still learn a lot. And lastly, I'll say thank you to our sponsors, Roe Foundation and the Defeating Epilepsy Foundation, both based in the US, that actually supported us for us to be able to run this course. Without their support, it would have been almost impossible to run the course. So thank you, everyone. Thank you for the team that put this together. And thank you for those that, to those at home that will be watching this as well, connecting with our organization, Pretola Global Health, Torie Epilepsy Sparks, and Epilepsy Warriors Foundation, Malawi. Find us on social media and connect with us. Do have a lovely day and take care. Bye.
Take care, be safe, everyone. Bye-bye.
Bye.
Bye.
Bye.